Hi, folks and medical learners who are interested in engaging research in new and creative ways. My name's Sarah Leeuw. I work with the Northern Medical Program, and I'm the Research Director of the Health Arts Research Centre at UNBC. I also work with the National Collaborating Centre for Aboriginal Health, and I'm a Michael Smith Foundation for Health Research sponsored scholar in the Northern Health Authority, where my work and research concentrates almost entirely on use of creative arts to engage questions about health inequities between Indigenous and non-Indigenous people. So I'm excited today for the next 10 minutes to take you through some of the research projects that we've undertaken in the North, as well as talk about the potential of using creative arts methodologies for your own research purposes as you undertake family medical practice. I'll begin by orienting to the arts and humanities as it intersects with health and medicine, and I'll briefly overview some of those theoretical terms, and I'll also think about it in terms of education, your own education, and potentially as future teachers and educators when you move out into the world. And then I'll also think about arts and medicine in terms of its relevance to practice and potentially policy. The way that I'm going to hopefully guide you through a discussion about the applicability of arts and creativity and the humanities to medical practice, education, and research is to offer you an overview of two recent projects that we are continuing to undertake specific to Northern medical practice and one that's specific to Indigenous people's health. Hopefully by the end of this 10 minutes, we'll be able to also orient to where this might all go in the future. Sometimes when we think about medicine, humanities, and creative arts, we don't understand precisely where they intersect or what the applicability to research might be for the arts and the humanities. I think it's important to note that there's a long history of a relationship between medicine and art. In fact, the very word medicine is derived from Latin ars medicina, which means the art of healing. Ultimately, medicine and medical education, medical practice, and medical research is as much a science as it is an art. There are also a series of ways that we can engage the arts, the humanities, and creative practices in order to address what many are saying increasingly are some fairly systemic challenges with medical practice and medical education across the Americas. So for instance, in 2010, there was a fairly systematic review done of medical practices in the Americas that noted for the last 150 years, really since science has come to dominate the discipline of medicine, that there are a series of challenges that have become embedded in medical practice, including, for instance, poor teamwork and a lack of contextual understanding of a lack of contextual understanding and a focus on episodic encounters rather than continuous care. Many people have noted that using arts and humanities in creative practices may improve what is a somewhat challenged medical system. So according to people who have written in places like academic medicine, we may be able to use the humanities and creativity as intricate and sympathetic knowledges about the human condition, as well as their ability to examine pluralistic experiential knowledge, which might help ensure a morally sensitive, narrowly sound, and deeply professional clinical practice. In other words, there's a growing body of literature and a growing body of research that is arguing specifically that we can engage humanities and creative projects and practices in undertaking medical research, medical education, and medical practice. There's also a growing body of folks who are medical clinicians and practitioners themselves who are writing about the importance of stories and creative practices in their practice and indeed in their research. So for instance, Vincent Lamb, who won the Governor General Award in 2005 with his book Bloodletting and Other Miraculous Cures, has noted that it would be a shame if we lose the art of medicine. And indeed, as I hope we can get to by the end of this lecture, the art of medicine translates into research in medicine as well. We can now move to thinking about putting ideas about creativity and arts-based research into practice. So when you are considering undertaking your research project, it's important to expand your vision and your thought process to the possibilities of working with groups of people, human subjects as they're called in research projects and practices, to expand your vision and your scope to include the possibility of creative-based practices. Now, you might think about these in some fairly applied ways. You could think, for instance, about using methods and tools such as autoethnography, critical reflection, or biographic narrative interpretive methods, all of which essentially are story-based. So you're thinking about collecting stories from the people with whom you're working as research subjects, and then critically analyzing those stories and narratives and putting them into a larger context. This is particularly important if we are considering working with Indigenous peoples because stories are so fundamental to cultural health and well-being, as well as the health of individuals and communities. In Prince George, we've undertaken a number of projects, research-based, that bring physicians, healthcare providers, and medical students into art galleries to have them critically engage with pieces of visual arts that they may not understand. A practical research application of this is to measure the transformed character of people who engage with art as a pre and post-op of their workshop. So very practically speaking, we're asking physicians and healthcare practitioners to actively and critically engage pieces of contemporary art in a silent and sustained and critical manner. And we're then measuring whether or not their general sensitivity and their ability to understand stories and to listen more acutely to different perspectives are transformed by that experience. That's an arts-based research method in action. You might also think about working in the area of narrative medicine, which is charting the possibilities of patients or other human subjects with whom you might choose to work, their ability to tell their stories, including their patient journey maps or their experiences with the healthcare system in a narrative and storied manner, which you then return to for your research by looking at for thematic analysis. You might think about discursive analysis, looking at the overlay of sociocultural power contexts and how those manifest in a patient or a human subject story. But again, you're always returning to an arts-based research method. You're extracting information in a creative manner from folks, and you're then using your research skills and tools to critically analyze and unpack that data. It's also extremely important to understand that arts and humanities have particular applicability for research projects involving Indigenous people. There's a long history and a long evidence base suggesting that a legacy of poor health with Indigenous people requires spiritual and cultural rejuvenation, much of which can be linked to humanities and arts-based methods. Storytelling and cultural rejuvenation, as well as ceremony and arts-based practices such as producing visual arts, carving, theater, dancing, collecting of food, any activity that isn't a didactic route activity might be considered a creative practice within Indigenous communities. It might thus be a possibility in your research exercises to tap into those creative potentials in Indigenous communities and try to unpack and understand that as it applies to your practice in medicine, to your medical practices. For instance, we've undertaken large research projects in the community of Nakasley, which is a small northern British Columbian reserve community, where we begin with mark-making exercises as an opening to a research project. We ask people, in efforts to ensure that they are less self-conscious about their art practice, to close their eyes and slowly begin to meditate on a place that's important to them through expressing it in a lined and mark-making activity. They simply draw on pieces of foolscap in front of them, and they meditate with their eyes closed on a place that's important to them. That practice in a research project allows for a concrete image by which we can then engage our research participants in them retelling their stories, their experiences of that place, and then asking them to connect it to their own senses of health and well-being in the communities. That's a very applied way that through visual practice, we're able to access Indigenous information and Indigenous stories, while at the same time community members are coming together to express in a non-deficit-based way their extraordinary stories of health and well-being in their communities. These phenomenal images are the kinds of research archives that we're then left with when we undertake a research project with First Nations communities that ask Indigenous people to express their feelings around health and well-being, not in a standard surveyed way or in a way that's capturable through quantitative research, but instead in a qualitative, arts-based manner. We also use visual mapping to encourage people to tell their stories, their connections to the land, and we use it in a group environment, so people are actually moving beyond a purely focused group method to a sharing circle, which is a creative and arts-based and arts-anchored method that works extremely well in Indigenous communities. People are encouraged to tell their stories through visuals that they create in a visual art map-making exercise. These kinds of research methods, in our experience, including mask making, including working with clay, including visual collaging, what they do is they open a new space for people to express their feelings around what is needed in their community to expand health and well-being. We'll just go through a couple of phenomenally powerful images that might come for further analysis in research if you ask your research participants or if you center your research project around an arts-based method. So if you move away from simply a didactic, survey-based or static interview-based series of methods and ask for participants instead to express themselves creatively or visually, even poetically or even musically, and you use those archives and that data as a means of further accessing stories that participants might have. One of the things, particularly when working with Indigenous research participants, that seems to come clear over and over again, and that is the kind of thing that one might concentrate on with research projects that engage creative, humanities-based and arts-based research methods and methodologies, is that there's a tremendous connection with place and land that is only able to be expressed visually. So through these remarkably dynamic and evolving images of land and place as absolutely connected to health and well-being in Indigenous communities. Visual arts and poetic expression and large storied narratives also allow participants to express not only their connection with place, but some of their politics that are connected to health and well-being. So for instance, a critical discursive analysis of extractive industries in small communities. Again, when using creative methods to engage participants, what comes out is a more robust and holistic data set. There are other ways that medical learners might engage art and creativity when thinking about undertaking research projects. One of the things that comes immediately to mind is using critical creative self-reflexivity. So that's a very standard tool wherein through the process of collecting data, perhaps narrative data, perhaps visual data, a student or a practitioner or an educator or a clinician goes back and critically evaluates their own relationship to that data. It's an autoethnographic process, so you're using your own stories and your own reflections on creatively elicited research data to position yourself vis-a-vis that relationship. We've seen publications come out of the Northern Medical Program in journals like the BC Medical Journal, where students and medical learners are using critical creative self-reflexivity to think about their own positionality vis-a-vis work with Indigenous communities. So in other words, using creative-based research methods in order to critically self-reflect on data and information that's gathered through an arts-based process is in fact leading to the possibility of getting that work published in research journals. Which leads us in summation to where all of these projects and arts-based research methods and methodologies might go. I will gesture first and foremost to other people's work and research in this area. Certainly there's been publications in places like The Lancet that suggest that a sound grounding in the arts and humanities can enable an effectively critical, humane, and ethical response to some of the very large questions that face medical researchers and medical clinicians and practitioners. In 2003, the Council for Science and Technology in the UK observed that the greatest challenges for society are all ones in which the arts and humanities and science and technology need each other. Medical education, medical practice, and medical research is about understanding and imagination as well as training and skills. There are then many ways that the arts and humanities might be drawn on in your own research trajectories. You might consider writing creatively about your research process and your research project. You might think about drawing research information from patients and from research participants in arts-based methods. For instance, you could be using visual arts to encourage people to speak about their health realities, their experiences of illness, their experience and visions of health. You could ask participants to generate information in a narrative format, and you could use autoethnographic critical reflection to reflect and think back on the ways that that information was generated and the ways that it impacted you. You might collect creatively biographic information and then use interpretive methods in order to unpack and discursively analyze those narratives that you've collected. Most importantly, the kinds of arts-based research and methods that you use in your projects should help you connect to your patients, in the future to your students, and possibly for people whom you develop policy for and about. Arts-based research methods might in fact be therapeutic for all of us. We might be able to elicit therapeutic kinds of narratives and stories from the people with whom we are working, but we might also find that those collections and that process is therapeutic for us as practitioners and as researchers. Because at its heart, research should be about sharing and disseminating knowledge and connecting with other people. If we think about using arts-based research methods, visual arts to draw narratives from participants, collection from participants in stories and in poetic form or in essay form, it may indeed allow for deeper connectivity between ourselves as researchers and people with whom we work. Of course, there's a growing body of literature that suggests that the creative arts and arts-based research methods and methodologies will in fact spur innovation and creativity in the future. So I think that's where I'll end, and should there be any questions after this, people are more than welcome to get in touch with me.